Hi, my name is Madison Ash. I am a Mercy College of Nursing BSN student for the spring of 2018. Today I'll be presenting about implementing bedside report in bedside nursing. What is bedside report and why am I discussing this topic today? Bedside report is a process where nurses are able to provide shift-to-shift report at the patient's bedside. This is allowing the nurse to lay eyes on the patient immediately, allowing the patient to ask questions, and for them to be involved in their care. This is an important topic to me because I like my patients to know what is going on in their care rather than just providing interventions and giving medications. Traditional shift change versus bedside report. The reason that bedside report is more important to a patient's care is that it improves communication between families by allowing each nurse to go into the room and discuss the plan of care. And it allows for you to lay eyes with the other nurse on the patient to verify what they are telling you in report and make sure that any medications that are vital, such as Levophed, are current and hanging and not about to be out. This is a good way to prevent safety and sentinel event issues. You can make sure that your patient's vitals are as stated in report. It makes the patient more satisfied having a nurse in their room at an extra time. It is less likely that a fall will occur because their needs are being met more appropriately. A PICOT statement is a standard format for developing research questions. This is a process of making your question that you're asking more reliable with better ways to back your research. The P for population and patient are acute care patients, preferably hospital setting. Intervention. Does bedside shift report compared to traditional shift report done at the central nurses station improve safety and communication? Comparison. Traditional shift report done at the central nurses station. The outcome would be, are the patients satisfied with their care, safety improved with improved patient outcomes? My time frame would be a 6-month period. I think realistically this could be implemented immediately and then the results looked at after 6 months. So for my complete statement, for acute care patients, does bedside shift report compared to traditional shift report done at central nursing stations improve safety and communication, along with provide patient satisfaction in their care, with better patient outcomes over a 6-month period? Much time went into the research that was conducted for this topic of bedside report. The database that I accessed was the CINAHL database, and I accessed it through the Southwest Baptist University Library. The search term that I applied for my topic was bedside shift report and patient satisfaction and safety. With these Boolean operators, I resulted with 147 articles that were appropriate for my topic of bedside report. After skimming through, I found that a lot of them were just quality improvement and expert opinion. So I then narrowed the search by using patient outcomes in my keywords and inclusion criteria, only full PDF articles, and I narrowed the time frame down from 2012 to 2018 for the research. My results then went from 147 articles down to 58. I skimmed the abstracts of the articles along with the titles of the articles down to 12. This topic did not have a lot of higher level research, mainly the lower level meta-analysis and consisted of the quality improvements. I then was able to select the 5 articles for review from those final 12. As stated earlier, with my search results, it was difficult to find actual research studies that were conducted on bedside report. It was definitely more professional opinion and quality improvement articles, lots of case studies with just simple examples, and solid numbers were not always given on patient satisfaction with analysis being conducted. 2 of the 5 actual articles yielded solid numbers on patient satisfaction, and they provided that the S-bar tool being put into practice, with communication errors between nurses being reduced by implementing the bedside report. Currently on my floor, we utilize the S-bar for all communication between providers, nurse to nurse, family to nurse, and physician to nurse. The main article that I chose for my research was done with a convenience sample in a hospital. This was done by pre and post surveys of looking at the implementation of bedside report. I chose this article because it was most applicable to my topic and supported my PICO question the best. With my findings, there were a lot of similarities on communication standardization and efficiency. Maxon stated that with using bedside report, communication would be improved between families, nurses, physicians, and nurses. This also improves patient satisfaction and their patient outcomes. Making the patient feel like they are more involved in their care makes them a happier patient. Nurse satisfaction has also been improved. Many nurses like to know what they are getting into at the start of their shift, rather than have something crashing down in the middle of their shift. It allows for appropriate planning, and if any phone calls need to be placed to physicians or any emergent interventions need to be taken. Another similarity is that family and patient involvement in care was increased by the communication and involvement and questions answered from nurse to families and patients. Unfortunately, this type of research had some gaps included. It was hard to find consistent numbers for safety-related occurrences. As I stated before, much of the research was quality improvement and/or case-by-case example. Another gap is that open-ended feedback from patients was not collected from the study that were present with the surveys. It would have been nice to see patients' opinions rather than just numbers on how they feel about bedside report. An inconsistency that I have found throughout this research is that one of the case studies, a nurse said that bedside report needs to be done every time, every day, because a patient was going into respiratory distress and was blue and unresponsive. While I agree with her that bedside report is vital, I think that this kind of falls on the previous shift on not checking on the patient. The study was conducted on a very busy medical ICU unit, and the patient had not been checked on for quite a while. So hourly rounding is very important as well with the bedside report. There were some limitations on this type of research. A couple of the articles that were chosen is that the size of the unit that the studies were conducted on with the patient population sample were not adequate. The researchers did not feel that that size was able to appropriately take a view of the entire hospital on bedside report. Also, many of the articles did not have statistical numbers given. It was more matter of opinion and expert opinion on these topics. Another, by Johnson and Cowan, only conducted their research on a women's medical surgical unit, and they feel that if they were able to reach more patients in different areas, that they might have gotten different results, or at least back to the results that they got, proving their research more solid. And unfortunately, with this topic, it's not easy to apply many inclusion and exclusion criteria besides having the inpatient population. It could be applied to all patients on all floors and should be applied to all of those patients. My conclusion, based off the research that I have conducted, I feel that there is adequate information and evidence supporting the implementation of bedside report. Although many of the studies did not provide statistical analysis on the subject, it improves patient satisfaction, nurse satisfaction, and prevents sentinel events. This is not a difficult practice change to implement. It is very simple to change this practice. The biggest problem will be to get everyone on board. I know personally a lot of nurses do not want to get up and go look in the patient's room. It is important to get everyone to consistently perform the report at the bedside rather than the nurse's station, to involve the patients in their care and verify the information that is being given in report. Patient satisfaction, safety, and nurse-to-nurse communication will be improved via this process of reporting at the bedside versus the central nurse's station. This is a large practice change for many nurses, especially those who have been doing it for a long time, but it is a simple fix for our patients and nurses relating to our communication breakdown, safety events, and verification of information being given. Thank you for watching this presentation.